So there are a couple of key types of knee pain that really are important in figuring out what's going to help you the very most. And so understanding where your knee pain is coming from can be really helpful. So some of the key types are pains that are caused when we move, tend to be more things with tendons or muscles, if it gets worse as we move, or sometimes some of the joint surfaces that get flared up from friction, and that usually has to do with poor alignment from our hips and other things like that that's causing things to rub or not move quite well in our knee. So strengthening those things up, improving that knee alignment by getting the strength right, and sometimes some analysis of how you move can help with that as well. But the movement-based things where we move more and you pay for it later, or it starts hurting during, that's one of the key areas. And we often see those kind of in the front of the knee, in that patellar tendon, or we'll see that what we call patellofemoral pain, where it's rubbing your kneecap on your femur. That can be pretty painful, and that one we usually feel right underneath the kneecap. And then we can get some like IT band syndrome stuff, where that IT band is compressing into the side of your knee, and so you can get some pain there. There are some pains that we pay for it later. So often we'll see things where we were moving, we were active, and then we'll get achiness in our knee from swelling that occurs, and that can be things like your meniscus or other ligaments that have been strained. And then as the fluid builds up in the knee, we really feel that. And so that can be pretty painful. So that's stuff that you kind of pay for later, not always painful during, and sometimes can even kind of go away during. They warm up and go away during activity, but then you pay for it later. And then kind of the last phase is more of the arthritic changes. So building arthritis in the knee, where your meniscus kind of gets deflated, or where you're starting to build up what we call osteophytes, or little calcium deposits in the knee and stuff like that. And that kind of pain is often associated with weather changes, with achiness, especially at night, or when you first start to move. If it's really sharply painful when you first start to move, but it feels like deep inside the knee, those are often things associated with more arthritic changes. And so those types of pains can all affect how you move, doing things like stairs or running, walking, standing, and all of those things though can be helped by just moving in the right way. And so it's finding the right pattern of movement that's going to help you build up your strength, reduce the fluid inside the knee so that you're not feeling the effects of the swelling, and then build up the strength in it enough that you're not accumulating more wear and tear that makes the fluid build up. So by increasing the strength and improving the alignment by strengthening those hips, we can reduce the causes of why it's flaring up in the first place. And so then we can stay strong, we can be healthy, and we can move the way you want, and your knee pain doesn't have to be a permanent problem.